face-to-face meeting of the Health and Wellbeing Board. To those members who've joined the meeting in person and to those who are joining remotely, you're also very welcome. And there are officers and some members of the public, we hope, watching us via the live stream. I'm just going to ask Democratic Services to set out the housekeeping arrangements for the meeting, because I think this will be quite
many thanks. If I can just go through the housekeeping arrangements, bear with me for one moment. So please note that this meeting of the board is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. Please could everyone present follow these ground rules. Only speak when invited to by the chairman. Please use the microphones on your desk when speaking, and please do when not talking. If you are accessing the meeting via Teams, please turn on your video function when invited to speak. If you are accessing via Teams and would like to speak on an item, please do so by utilising the raise your hand feature in the bar at the top of the Teams window. And obviously, just for clarification, in view of the fact that we are back to face-to-face, to confirm only those members of the board that are actually present in the committee suite will be able to vote. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the ground floor of the multi-storey car park. And finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. Thank you.
Thank you very much, Karen. I wonder if you could also take us through agenda items 1, 2 and 3.
Absolutely, that's not a problem at all. So agenda item 1 is apologies. If I can report that we have apologies from Graham Farrant, BCP Council Chief Executive, Elaine Redding, BCP Council Corporate Director, Sian Thomas, our Education Rep, Karen Loftus from Community Action Network, and Sally Sandcraft from CCG. Agenda item 2, substitute members. Can I report that Kelly Twitching is here substituting formally for Elaine Redding, and Steve Place, who I understand is probably joining us remotely, is substituting for Karen Loftus. Chairman, that then takes you to item 3 on your agenda, which is the election of chairman. If you're happy for me to take the board through that, if I can ask from those members in the room for nominations for the role of chairman, please. Councillor Rampton.
Thank you, Karen. I'd like to nominate Councillor Nicola Green.
Is that nomination seconded? Thank you. Are there any other nominations? There being no other nominations, Councillor Green, you are duly elected chairman.
Thank you very much, Karen. Members, and I'm very glad that you didn't have to use the Blue Peter approach to secret ballots, which we might have needed to resort to. We'll move on now to nominations for the role of vice chairman. And if I may, from the chair, I'd like to nominate Tim Goodson and seek a seconder. Karen, are there any other nominations? I think you've got the job, Tim. Thank you, and thank you for your support for the board over the past year as well. Thank you. Right, agenda item 5. I need to ask whether there are any disclosable pecuniary interests or local interests in respect of issues before the board today. Councillor Dove.
Thank you. I just want to meet a family member who is in support of SEND services for later on in the report.
Thank you. No others? Then we'll move on to the public issues, and there are none for today. So moving on to the real business before us, we have the minutes of the board held when we last met back in March. Are there any comments or matters arising which aren't dealt with elsewhere on the agenda? Nope, then we will treat those as a true and accurate record. Thank you, Karen, thank you for preparing them. Now we move on to the action sheet. Any comments on those, or are we happy to take them forward? Right, jolly good. Item 8, which is the business protocol and our membership and our terms of reference. It's usually a very quick item, having set them up in the first place, but I think there's a bit of a discussion being had about how we can best do our business as we're moving back into face-to-face meetings. I have to say, from my perspective, the input of members and the flexibility that was allowed by holding our meetings virtually was really welcome, and certainly saved a lot of people lots of travel time. Also, we were able to do a number of things and bring lots of partners in. Those were, of course, held under the coronavirus emergency powers, which are no longer available to us. So we have to have face-to-face meetings, and we are only those members in the room are able to vote. But I do think it's really important that we think about what it is as a board, how we want to do our business, and I would certainly welcome the participation of as many people as we can virtually. So we've sort of come up with a bit of a suggestion where we can be as light touch as we're allowed to be under the legislation. But given that we do most of our business by consensus, I would certainly welcome the opportunity that people shouldn't feel that they're disengaged by being unable to attend every meeting in person. So Karen, can I ask you to take us through that paper? Thank you.
Thank you, Chairman. The paper is circulated with your agenda papers, and we normally do this when we elect our chairman and vice chairman at each meeting. As you've indicated, it's an opportunity to review our practices, but equally it's to look at our membership, to consider any tweaks, changes that are necessary. And I think in line with one of the issues that the chairman's highlighted, there is a potential opportunity to look at the quorum that we've set in the membership, which currently states 10 members of the board, which must include 2 councillors and 2 health/NHS reps. There is a suggestion that has been put forward, Chairman, as to maybe looking to identify quorum being 7 members of the board, to include 1 councillor, 1 NHS representative, and the Director of Public Health. So that's open for discussion with the board as to whether you feel that that is an appropriate amendment. I'll hand back to you.
Questions, comments from members? See a nod from Councillor White. Karen, did you want to come in?
Chair, just a quick question really. Is that for the following year, or is that subject to change if restrictions are changed?
I presume it's up to the board to review its membership and protocols should it feel the need to, and should anything change. This is just an annual report which is required by the terms of reference that set us up. So I don't think it's set in stone if anything should change. Is that correct?
Absolutely. I think if you wanted to make a change to your quorum, my view would be that you can make that an immediate change so that that can be applicable for future meetings of the board. The protocol and how you've operated is always sat with you as board members. So I can check if there's any further approvals required, but I would hope that we could implement that quickly.
Thank you. And just in the unlikely event, and Sam, please don't think that we're suggesting that you wouldn't be joining us. Would it be appropriate to say the Director of Public Health or his appointed substitute?
Chairman, I think that's an entirely acceptable approach. I think the protocol does indicate at the moment that we do operate substitutes, so I think we can build that into the protocol if that's the wish of the board.
That helpful, Sam. Sorry. We're all happy, and we'll adopt that. Thank you as our protocol going forward. It's very timely, because agenda item 9 is the update on the local outbreak management plan, which is a paper for you to. Oh, apologies, Jan. Thank you.
Could we just note, Chair, that at item 14 we will be discussing whether we wish to enable other independent chairs to have observer status, so that would have an impact on the protocol. Just to tie up the two ends of the agenda.
Thank you. We'll note that at the time. Thanks.
Thank you very much, Chair, and good morning, board members. So, under agenda item 9, you have an update on the refreshed local outbreak management plan, which the board approved back in March. I have to say, at time of writing, the report was attempting to give you the current situation under those 4 priorities under the plan. I think it might be helpful with Chair's approval if I just update the board verbally, because the situation has changed slightly over the past couple of weeks. So if it's okay, I was just going to give you a few headlines that build on the rest of the paper. Not intending to go through the paper in a huge amount of detail, but obviously if members have got questions relating to those any points, I'm very happy to take those. So at the time of writing, one of the first priorities in the refresh is obviously to try to do all that we can to keep the infection rates as low as possible in our communities. We were confidently saying that the 7-day infection rate at the time was below 10 cases per 100,000, and it hadn't been above 25 cases per 100,000 since back in March time. In the last couple of weeks in particular, we've seen that situation change quite quickly. The southwest of England always lags behind the rest of England in terms of what's going on in terms of infection rates elsewhere. And in the past couple of weeks, rates have risen under both council areas. So the BCP council rate currently is around 60 cases per 100,000, and we'd expect that to rise over the next few days, given what we're seeing coming through our local information systems. And it's a similar situation in many of the other councils across the southwest. So southwest England has also seen a rise in its infection rate. It's now around 45 cases per 100,000, and the rate for England is well over 70. I'd expect it to be 75 or maybe even 80 today. I have to say it was predicted by our local modelling. So we have been regularly running an epicell group, and the paper talks a little bit about that in terms of our need to continue to provide ongoing enhanced surveillance, including the work that we're doing around variants of concern. All of the national models predicted that as we go through step 3 of the roadmap, we would see an increase in infection rates. The important thing to realise is that so far, it does look on the basis of the information on hospital admissions as if that link between high community infection rates and hospital admissions is very much weakened, which is fantastic news. But obviously we are watching that situation very, very carefully. At the moment, there are, I believe, 3 people in hospital in the Dorset system. That was the situation when we looked yesterday, but we'll continue to obviously review that. I think obviously we have the pause announced on Monday. It was sensible in my view, as it gives us a number of weeks to continue to progress the vaccination programme. That is going extremely well. We've got extremely good coverage in most of the older age groups, and the booking is opening up very rapidly to try to make sure that we vaccinate those younger age groups. I believe that from the end of this week, the booking will open for anyone over the age of 21. So you can see just how quickly we're starting to reach into those younger cohorts. And in terms of the local context, that's really important, because what we know from our incidents and outbreaks, it is predominantly younger age groups that are seeing that increase in infections. So cohorts locally with the highest infection rates is the 17 to 18-year-olds and the 19 to 24-year-olds. So the Local Outbreak Engagement Board, which is a subcommittee of the Health and Wellbeing Board, met yesterday, and we were just running through the current situation and reinforcing our agreement about the comms messages. So over the next few weeks, across both council areas, the Health Protection Board, comms colleagues and colleagues in both councils will be working quite hard to push the 2 interventions that will be most important over the next few weeks. That's obviously making people aware of the opportunities to get vaccinated, the importance of having 2 doses, because 2 doses of the vaccine provides the most protection you can get against the Delta variant. Make sure that we're getting that message out to our younger age groups through Trusted Voices networks, but also increasingly looking to work with local employers. asking local employers to also reinforce those messages about vaccination, but also to continue twice a week. We've had a number of incidents and outbreaks affecting the hospitality sector in the last week, and it's quite clear that there are people working in that sector that are not regularly testing. So we're continuing to reinforce that message that the best way to protect your friends, your family, customers and your business is if you can support regular twice weekly lateral flow testing. I'm happy to pause there, Chair, and take any questions that people may have.
Thank you, Sam. Happy to take any questions, comments or anything from partners who might wish to share a perspective for the board. Tim?
Thank you, Chair. And I'm just going to go to sort of paragraph 7 there, where we've got the difference really in the proportion of the unvaccinated in the least deprived areas, and between the least and the most deprived. And we've seen this since the start of the vaccination programme, and it really continues on from the flu vaccination and other similar ones. And whilst we know at the start, I think it's implied here that the elderly population was in the least deprived, so we expected it to be higher. We haven't seen the levelling up, I would say, as much as we would like. So we are trying to do a lot more in that area with just some of the community leaders, pop-up clinics, and really sort of working with some of the minority groups there. But it does still remain an issue, I would say, particularly in the larger conurbations, and we can see this repeated across the southwest as well in Bristol and Bournemouth. So it's something we're very much aware of. And just trying to promote the use of the uptake of the vaccine in those areas, but it does stand out whenever you drill down into it. So I just want to sort of acknowledge that, really.
Thank you, Tim. I think that's something that we'll be bearing in mind when we look at the paper that's coming up later on. I don't want to put you on the spot, but I wonder if our colleagues from GP practice might wish to offer anything by way of perspective. So.
Yeah, I mean, I was at our local hub vaccinating yesterday, and we'll be there again this afternoon. We're already vaccinating down to 18-year-olds, so we're pretty much coming to the end of vaccinating everybody who wants to be vaccinated in terms of a first dose. It's getting more difficult to actually get people in. I can understand why some of the younger people are reluctant to have an immunisation, because they don't necessarily perceive themselves to be at risk. So I can clearly understand that, and so we are having more difficulties in sort of getting a high percentage of the sort of youngsters in. I guess for me at this point it's going to be more about we've done a lot of the older people twice, so that down to probably, well, under the 40-year-olds now, they've pretty much all had second doses. And so it is just the sort of very young people now who are going to get their first dose. I just wonder how long it will be before we'll get through those and then need to offer them a second dose. I actually think it'll be considerably under 8 weeks, and what the policy will be in terms of allowing us to do that.
Thank you, Sam. That's very helpful. Kelly, I'm sorry to put you on the spot, but it just occurs to me with our corporate parenting hat on that we have a cohort of care experienced young people, and I just wondered perhaps you might like to speak to any actions that are being taken or just offer the support that we can to make sure that we reach those young people.
Yeah, actually, just as you were talking about, as Sam was talking, it did occur to me that actually we can support there with, and especially with encouraging our young people to take up the offer. Certainly looking at our care experienced young people. So I can certainly take that back and talk with social care colleagues about what we can do to ensure that we're really promoting the offer that's out there for our young people and how important it is for them to take it up. So yes, I'll certainly take that forward.
That's very helpful. Thank you. I think it shows that around this board, and I can see at least a couple of officers on the who will be joining us later, who will be accessing all their networks to ensure that we're reaching as many groups as we can, whether through those trusted voices, Sam, that you've spoken about, or perhaps more informally as well. So thank you, Sam, for the Sorry, I am now just checking. And Steve Place, my apologies for not noticing your hand sooner. I have now got the participation up. I'm not the most technically whizzy person, so I'm trying to manage 3 things at once, which is, if I haven't got a cup of tea, that's tricky. But I can see you all now, so do please continue to put your hands up. But I think with that in mind and that discussion, thank you very much, Sam. We will move on now to item 11, Karen. Oh, Paul, have I missed you out?
Yeah. Just to clarify, Chairman, item 10, which is the health and wellbeing strategy, promoting healthy lives, supporting mental wellbeing and improving mental health. And I think that's Mr. Iggulden too.
Thank you. Thank you, Kat. We are very keen to hear from you, but I will stick to the agenda. Paul, my apologies. Please go ahead.
Thank you, Chair. Thank you, Karen. So there's a report in the pack. I'll just give a little introduction to the recommendations in that report. So back at the December board meeting, a range of mental health and wellbeing initiatives were reported to the board across 3 themes: supporting our communities, supporting our staff wellbeing, and working to prevent suicides. And in the conversation that followed that presentation, the board requested that stakeholders support a stock take workshop to see if there were any additional activities we felt would be needed to support mental wellbeing. And the report both thanks the people that contributed to that workshop that was held in February, and thanking them for subsequent conversations as well. And the report identifies key themes and recommendations So the 3 key themes are understanding the landscape, it's time to talk, place, and the idea of working through the lens of where people spend time, and improving our joined up working. And I'll just talk a little bit to each of those before going to the recommendations. So understanding our landscape, the participants in the workshop talked to 3 sort of levels. First level, a low level support, second level around initial diagnosis, and a third professional intervention level, and quickly came to the conclusion that the real focus of this work on behalf of the Health and Wellbeing Board would be around level 1, the sort of wellbeing support that can be made available, and in particular how we work to build a shared understanding across our communities of what are the signs of good mental wellbeing, when might we recognise that we have or problems are emerging, and where to go for help when they're spotted, whether that's in ourselves or in our friends, colleagues, peers. And it's time to talk. There was a lot of mention in the workshops around people's ability to access offers of help is often limited by either recognition or reluctance to ask for help or acknowledge that there are issues. So a number of conversation points point to the continuing existence of stigma around asking for help in this area, and that emotional distress is often poorly understood. So questions were raised about whether we could help develop tools to help people recognise when either they might need help or to boost their resilience, or indeed whether they see in others the need for help. Places, and working through the lens of where people spend time. Partners felt that in the statutory sector, staff wellbeing was being well supported through the pandemic in terms of mental health and wellbeing, but less clear about what offers were in place for local businesses. So the question posed, could we extend the offers of training and support to the wider workforce? In the school and educational establishments, there are offers developed and being offered to pupils, but support to staff was perhaps less clear. and noting that lots of pressure on staff at this time and that they may need additional support. I think it's fair to say what was notable by its absence in the conversation was mention of the offer to people in their homes or communities. And the third main theme was around the notion of joined up working and the seams between different services. So individuals and professionals are often aware of the medical services and interventions available, but felt that there was a great provide information, advice and guidance regarding preventative measures and the non-medical. So many participants were unsure of where to refer or signpost people to for preventative support. So the recommendations in the report, there's 5 recommendations, Chair. Perhaps I could go through them one at a time and refer back to the board for support on them one at a time.
That would be great, thank you.
Yeah. So the first initiative that's being worked on or was identified was the idea of raising awareness to better understand the landscape of mental well-being, mental health. And during the course of the engagement work, the Light On campaign has been launched by Dorset partners. So colleagues contend that there's a good offer now in that space. Would wish to encourage Health and Wellbeing Board partners to review the Light On campaign and to offer feedback to that campaign through Joanna Quinn at Dorset Public Health Team. So that's the first initiative, and the recommendation there, Chair, is simply that we note that and encourage partners to feedback on how successful that has been.
Would anybody like to make any comments now, or prefer just to take the offer and indeed the request for feedback outside of the meeting? I think we'll do that, please, Paul.
Okay, thank you. Initiative 2. One of the things that the report notes is the simple online quiz that's available through Every Mind Matters, which allows people to answer 5 questions and get some advice on where they might go for what they might do by way of response to improve their mental well-being. Colleagues, having reviewed that, feel it lacks the sort of differentiation. Nearly all of whatever the responses to the questions, the advice tends to be low-level support, advice to exercise, to look after oneself, almost advice along the lines of the 5 ways to wellbeing, and a sense that perhaps there's a need to think about something that's a little bit more discerning, that allows for people being able to be referred on to help rather than self-help. So the notion of an online triage tool has been discussed, and I'm in conversation with colleagues at Dorset Healthcare about trying to develop that. We would welcome support from the board in terms of that being worked up into proof of concept with a view to perhaps being picked up by the BCP Smart Cities work to develop an app, if we can indeed get the sort of algorithm in the background set up.
So is that a request for help from partners?
It's really a request at this stage for board to be supportive. If through work with DCH we can develop such a concept, it would be useful to go to the BCP Smart Cities team with your support, really, to promote that as being developed into an app.
Thank you. Any particular comments? I think it just from me. Sorry, Sam. Go ahead.
Thanks, Chair. I'd support it, but let's be clear about the question that we're trying to resolve. I think that's really important. So I agree, a lot of those tools lack a bit of differentiation. They can be very, very generic, can't they? But if we could put some time into scoping exactly, what would be the added value of some sort of digital offer that would be, I think, really important rather than just forging ahead with the development work.
Sure.
Thank you, Sam. That's really helpful to have that focus. Steve.
Thank you, Chair. Paul, I'm sure you're aware about that the R3 Welfare Group have got a bounce back fund to use to develop a sort of first-stop shop, and is looking at the idea of an app to provide a one-stop shop for people in work or are losing work, leaving with anxiety and stuff that might come about either losing their job or actually even going out to work. So I think, you know, talking to Citizens Advice that's leading on that project would be helpful to sort of like meld them together.
Thank you, Steve, for raising that. I wanted to mention that while not here, for those who don't know, all the participants and all the many people who've contributed to this report, there is quite a lot of input from the economic development team within the council. And the reason for that is very much what Steve was alluding to, the relevance of businesses, small businesses, and our larger employers in the outreach that they've got into to their employers. And there is a specific welfare group set up, which is holding a lot of those conversations. So, and Paul, I know you're a regular attendee at that. So does that give you enough on that recommendation?
Thank you, Chair, and very helpful suggestion. Thank you, Steve. And I have been involved in working through that welfare R3 group, but that's a very good connection. Thank you. Initiative 3 was the idea of better promoting or making available a directory of community support resources to promote mental well-being. And colleagues within the workshop group kindly pooled their thoughts and resources to develop an initial sort of a listing that could become a directory. In the course of doing this work, I also come across similar, having been developed by Dorset Mind. So I think the next step with this work is to liaise with Dorset Mind to see whether we're adding value or merely replicating what they've already done. So I look to just note really that I'm happy to progress that as a further bit of work to join up with Dorset Mind and to see whether we have something useful that can support them, or indeed we have something new that we could work on together with them. So merely, I think, to note that as a next step for me to take this work forward, Chair.
Thank you, Paul. I certainly endorse the principle of it, but I think there will be some requests for focus, that we don't reinvent the wheel. We've got some very good networks and channels currently that have been set up and working and accessing a lot of people over the past year. So we don't want to, as I say, reinvent that. But I do think there's something that we can probably add. And if I could just put out the general offer for partners to contribute to that via you, would that be the sensible route? Sam, thank you.
Thank you, Chair. I just had a question that colleagues in the room might be able to help me with, because it's been a long time, forgive me, but there was a lot of work done under the Mental Health is Everyone's Business programme in Dorset, and I believe one of the outputs from the conference and the subsequent sessions was around a sort of community charter to try to increase the visibility of some of that low-level support. I've lost touch with it. I've no idea where it's got to, but it might just be worth asking some of the main mental health organisations in Dorset whether A, was there any final output from that, and B, you know, could we build on that and incorporate it into this work stream? That'd be really helpful.
Eugene, sorry.
Thank you, Chair. Sam, totally agree with that. I think that the charter had been started, and like with many things, the pandemic happened. So there is something about regrouping and making sure that information is socialized so that people know. And just as a general point, I'm very much in support of this stream of work and whatever we can do to use what already exists, because the difficulty is always where something looks new when it's already in place, and have a network that connects better with our communities, because that is the real acid test of whether this is going to make a difference in terms of people's health and well-being, but fully endorse the approach being taken.
Thank you, Eugene. That's very helpful. Am I right in thinking, Paul, that Initiative 4 is pretty straightforward? Is what it is.
Yep.
I was happy with that. But perhaps you could speak to Initiative 5.
Indeed. Just if I might share just on Initiative 4, I think it is straightforward, and it's just noteworthy that the value of bringing partners together to sometimes share insights and have conversations is example through Initiative 4, but there were people who didn't know, or it hadn't been made available to them, that there was funding available for training for SMEs. So bringing together stakeholders merely allowed us to put people together there and put people in contact with the source of funding. So that was very helpful, useful to do that. Initiatives 1, 2, 3 and 4 flow nicely out of the stakeholder engagement work, and there's some relatively small areas of follow-on work that I'm happy to carry on. Initiative 5 is perhaps looking to take this whole agenda on a little bit further in a slightly more structured, with the idea of signing up to the Public Health England Prevention Concordat. So as of December of 2020, Public Health England relaunched the Prevention Concordat and invited local authorities and other health partnerships to sign up. To be a signatory, we would need to agree to the consensus statement, which involves producing an action plan addressing the 5 domains of the framework, which are understanding local needs and assets, working together, taking action for prevention and promotion, including reducing health inequalities, for defining success and measuring outcomes, and leadership and direction. The Concordat gives us some access to PHE resources and some support in guiding us through this work. And there is interest at the moment from the multi-agency Dorset Suicide Prevention Steering Group in looking at the Prevention Concordat. It's on their agenda, I believe, for their next meeting. So, Chair, I think the Concordat would give us a structured framework for doing further work around mental wellbeing and seeing if we could go further faster in this agenda. Yes, so I would encourage Health and Wellbeing Board members to perhaps in principle sign up to this, and for us to explore through the Suicide Prevention Steering Group whether there's sufficient commitment to progress this. The work I've done to date with partners on this has been okay within the resources available. Lots of partners made contributions in terms of their time and expertise. I think to do the Prevention Concordat and to do it well and to make a difference, we will need some additional project support to progress this.
So this is the beginning of a conversation really with the board rather than seeking approval for today, because from the way you've described it, I don't think that would be appropriate at this stage. But just to go back to that stakeholder group, do you think it reaches far enough into the board and into the partnership, or are there particular people with whom further work is needed?
I think, Chair, that further work is needed and we could do more in this area. I would like to try and channel it through the Prevention Concordat to give a bit more structure to that work and give it more visibility.
Could I, thank you, Paul, could I perhaps ask board members what their reflections are, whether this is something they'd want a bit more work done on, and whether we feel confident that it's the right direction of travel in terms of adding value to work which is going on elsewhere, rather than further initiatives for that sake. Simon?
I'll just say that since the start of COVID in primary care, we've seen a step change in the number of people suffering with their mental health. So people who approach us who would never have approached us in the past are suddenly suffering with anxiety, depression. So just as a general with regards to this, there's probably never been a more important time that we need to address this. So it has my full support, really.
That's really helpful to hear. Thank you. Sam.
Thanks, Chair. I think when I read this, my reflection was that we've done an awful lot of work as a system over the past few years to put this in a much better place. So if you think back to 3 or 4 years ago, we didn't really have multi-agency suicide prevention plans or even council suicide prevention plans in as good place as they are now. So I guess there's probably 2 ways of looking at it, and I would question whether we would need, I don't think this is about additional work, I think it's about additional visibility within a very, very clear framework that actually brings a lot of the work that's already in train to the fore. And I think it's a good way of managing to make sure that we're consistent in what we're doing and keeping system partners together on this. It will be a priority. I agree with the comments made about what's presenting in primary care, and we'll shortly be bringing some of the refreshed narrative summaries from the Joint Strategic Needs Assessment to the Health and Wellbeing Board, and that very clearly shows that there'll be an ongoing requirement, I think, for us as a board to continue to look at mental health and wellbeing as a priority.
Thank you, Sam. Debbie.
Thank you. Just wanted to say, when I read this, I thought this looked like a really ideal way of taking forward the things that we want and need to do. It gives us a bit of a framework for doing that. And so just wanted to support that principle and taking account of what Sam just said about the visibility. And look, there's lots of work already, but we're better focused now, I think, on this need than ever before. And if we've got a framework that helps us to tackle that together consistently and to get, really best outcomes of that work, that's really good. With any concordat or any declaration, anything like that, I always want to know, so what does that mean? What does that mean for us? What's the detail of that? So for me, it looked very, I thought that was a really good thing to do, depending on advice from public health colleagues, but would really like to support this, but obviously want to know what it means.
Thank you, Debbie. We were very clear, weren't we, for those actually who before some of us were members of this board, in developing the strategy, mental health was a priority, and since we've become involved, we wanted it brought forward and running concurrently with the other priorities. So, Paul, I think you're pushing it an open door, and picking up on what people have said, I think we would probably want a further report, but we would be happy to adopt in principle the direction of travel, and do as light a touch piece of work as is needed for formal sign off. But I think in the light of the JSNA, which Sam's been speaking of, that would be perfect timing. But I'm happy to take some guidance of you outside the meeting as to what you think we need to do to bring this forward for full board approval. Does that help?
Yeah, thank you. Yeah, thank you, Chair.
Great. So we've been through all 5 of the initiatives. Is there anything else you'd like us to discuss in relation to that paper?
No, thank you, Chair. That's been very helpful. Thank you.
In which case, thank you very much. And Kat, thank you for waiting. It really is you now. Item 11 on our agenda, which is a focus that's been we've talked a great deal about, but I don't think we've brought the paper forward in quite this format, and it addresses deprivation within our community. Over to you, Kat.
Thank you, Chair. I'm just uploading it to my screen. I'd be grateful, Chair, as I can't see anyone at the moment. Could you just confirm if the presentation is loaded up for me?
It is available on every device in the Civic Centre.
Wonderful, thank you. Good morning, everybody. My name is Kat McMillan. I'm Head of Community Engagement at BCP Council. And I'm here today to talk to you under the Health and Wellbeing Strategy around Priority 1, engaging with and empowering communities of highest need to improve health life expectancy. So the purpose of the presentation is to give an overview of our proposed approach to developing vibrant communities in our priority neighbourhoods using strength-based approaches in partnership with our communities. And part of this involves a culture shift in the language we use, moving away from phrases like tackling deprivation and regeneration boards that focus on a deficit inside our communities to develop vibrant communities with a focus on what's strong, not what's wrong. Now, we've already identified the key communities that we currently want to work with in a vibrant way. So the next stage, which this presentation looks at, is how do we engage with those communities and work with them to identify strength-based approaches. We want vibrant communities to be at the heart of everything we do. So how do we do this? Well, we're not starting from scratch. We already deliver services in a vibrant and dynamic way. For example, we have innovative parks, large impactful festivals, and award-winning behaviour-changing services which help people across Dorset to make lifestyle changes to improve their well-being. There's a lot of evidence that public services that are delivered in partnership with the communities they represent provide more sustainable and better outcomes for residents. And this was very apparent during the presentation given earlier this year by Cormac Russell, who is a world-renowned expert in asset-based community development, or what I'm going to refer to as ABCD for short. The question we need to ask ourselves is, are we going far enough to involve people and give them enough ownership in the decisions that ultimately affect their lives? Can we work to the mantra of nothing about us without us? When looking at how we want to work in a priority neighbourhoods using strength-based approaches, we've seen the incredible outcomes that have been achieved by East Ayrshire Council in Scotland, which have transformed the way they work with their communities. They fundamentally changed the way they work with their communities by shifting the balance of power from local authority across to the communities they serve. They have embedded ABCD throughout the council with a starting point of acknowledging that the local authority's role is to serve its communities, and for that to happen, communities need to be truly at the heart of everything we do. Using a very simple process, working with the local community, they've established steering groups which held a series of community events to engage with residents. A series of deep listening events, engagement and surveys enabled the community to come together to form a community-led action plan, which the local community then delivered in partnership with the council and wider partners. And the key outcomes are detailed on this slide, but the fundamental change was a shift in how they engage with their communities, moving away from a model which felt very much like a business transaction between the council and the residents, and towards a relationship which placed those communities at the heart of everything they do. Cormac Russell describes ABCD as a bit like a three-lane motorway. In the first lane, what are the things that community can do for themselves by themselves? Let's create the environment for this to happen and let them do that. It's more sustainable, cost-effective, and it's good for our communities. In the second lane, what are the things that communities might need a bit of help with? Let's understand and enable that, but step away when our help isn't needed. We can always be brought back in if we're needed again. And in the third lane, what are the things that the council and partners should be doing? They need to do that, and we shouldn't expect communities to take on that work. ABCD is about enabling communities to do more themselves so that they become more empowered, more connected, more engaged on services, but more importantly, more vibrant communities. So we are proposing to the board that we take this approach and use it to work with our priority neighbourhoods across BCP, those that within the 20% most deprived under the indices of deprivation. In order to transform the relationship between the council and local communities, resident-led action plans will be at the very heart of everything we do. Our community development workers will work with the communities to identify community stakeholders who will then work with us and our partners to map the assets within those communities, identifying the areas of strengths and work to identify their main priorities. These resident-led action plans will be a two-way process where the council can engage and talk about their priorities, but ultimately the guiding principle of these action plans are that they will be solely based on what matters to the participants, the community. We have a good record of engaging with our communities in areas such as Bournemouth Estate, Townsend and Boscombe, but in some of our priority areas we'll be starting from scratch, and we'll need to take time to get to know the areas and the existing communities. The council is also in the process of developing a number of strategies that will feed into the development of vibrant communities. So the community and voluntary sector and volunteering strategy, which aims to increase volunteering across the conurbation, working with our partners can, but also to look at diversifying the volunteer offer within our own council and how we work with the community and voluntary sector. We've already got a good track record of volunteering at our festivals, in our parks and our community centres, but can we learn from Together We Can to bring volunteering into other services? The community engagement and consultation strategy outlines our approach to how we engage with our communities in a two-way conversation and look at how we can enhance our engagement and consultation process to ensure they are inclusive and far-reaching, ensuring we capture the voices of those seldom heard in decision-making processes. We need to actively listen to our communities and look at how we can include the lived experience in individuals as we work through the transformation of the council. Both of these strategies currently go to Cabinet in September. And what could the future be beyond area action plans? Well, the future of vibrant communities is really exciting. So the themes across our priorities could develop, such as skills and training or better support for early intervention. There could be the potential to think about council-owned assets and where are these best placed to sit, community or council? A key component we want to think about is evaluation. How do we measure the social impact of our approach to developing vibrant communities alongside the economic impact? And we may want to work with our partners, public health, the universities to think about how we achieve that. And how far do we want to go? Is a vibrant communities approach to procurement and commissioning different to what we currently do? Can we look at how we commission the community and voluntary sector so that local money stays in the local economy? Looking at how contracts we sign are designed around giving power and resources to local people where appropriate. So the proposal that we're seeking support from the Health and Wellbeing Board today is to take the model that East Ayrshire Council used to develop vibrant communities and implement this approach in our priority neighbourhoods. We're also proposing the development of a Vibrant Communities Partnership Board, which will oversee this work alongside the work of the two strategies I previously mentioned. Now, this rather busy slide, which I appreciate you might not be able to see very well, but hopefully you've had a chance to look at it in your pack. It details the structure that we were proposing. So you can see we have a work stream around empowering communities, which picks up our work around access to food that reports to the board around food inequality, area steering groups and working in priority neighbourhoods. The second column work stream is around the transformation of the council, and we have a dedicated work stream around communities and partnerships and looking at how we bed those strength-based approaches within the council as we develop. Then we have our community engagement stream, looking at the work we do with our community equality champions, our community champions, and the work underpinning the strategy. And then the fourth column is our work around the voluntary and community sector, about the conversations we have, about the grant funding that we're going to be awarding, and how we work with our partners, particularly CAN, on that. And underneath, you can see these cross-cutting themes that we have. So how does the ICS work alongside us? So we're looking very much at a place-based approach, and we work alongside in partnership with ICS about how they'll be tackling health inequalities at a more strategic level. Obviously, recovery from COVID is absolutely key to every one of us at the moment. Area forums right the way across, and of course, working within our 20% most deprived areas. So what's next? We need your support as system leaders. We need your buy-in to encourage active participation in vibrant communities. We want to work with you as we explore how we use strength-based approaches to working in communities, and we have no doubt that this approach will have significant outcomes for yourselves in terms of engagement as well. We need to develop a brand for vibrant communities, and we need to use our comms colleagues to raise awareness of this on the ground. So we'll look to develop the first phase of community action plans over the next year using the additional resources which have been given to us to invest in our asset-based community development approaches. And we'll also be looking at how we embed strength-based working across the council as part of its transformation and what resources are needed in terms of training and support. So if you support our proposal, this is our proposed timeline. We'll begin working with phase one over the summer, where community groups are already running and established, and we have community development workers in place, such as Townsend and Bourne Valley. We'll work with West Howe Community Enterprises, who are already delivering community development in West Howe, to see what the model looks like there and how we can support each other. Midsummer, we'll think about resource allocation. What will our team need to work in these communities and what additional training might be required? Also the development of a communication strategies to ensure that our work is vibrant. In the autumn, if things are working well, we'll be in a position to set up the steering groups in our priority areas or build on existing ones that may already be there. And these will include key community and public sector organisations already working there. We will work with the research team in Bournemouth, Christchurch and Poole Council and our partners in public health to develop community profiles in these areas. Now, unlike previous work, these won't be used to shape interventions like the FAST, but they will be used to inform and assist the community action plans. And in the winter, we'll begin the process of engaging with residents. We will use many tools such as traditional community development approaches that we use, working with our partners, our schools, all of those strength-based approaches around existing assets. And by the spring, we hope to be in a position to explore the themes identified through community engagement and invite the whole community to participate using community mapping exercises to really explore what people are proud of and what support they feel they can offer. And from this, a community action plan will be developed. An event will be taking place to celebrate all of this work. So I hope I've given you an overview of our ambitions and what we'd like to achieve. And I'd like to invite you to ask any questions you have, but equally I can also have detailed conversations with anyone offline if they'd like to know more. I hope you think what we're proposing is exciting. I certainly think it is, and the opportunity to do more with our communities rather than do to our communities is what we're hoping to achieve. So I will just stop sharing my screen now, and over to you, Chair.
Kat, thank you very much. I know how passionate you are on this topic, and thank you very much for that overview. Unfortunately, on the live stream, we were unable to make the slides available, but everybody could hear your talk, the way in which you spoke to them, and they have, of course, if anybody's watching, they have been published on the website, so they are accessible afterwards. Steve, you were top of my list anyway, so I'm so pleased that you're volunteering to speak, because I'm sure you have plenty to add to this.
Thank you, Chair. Yeah, in terms of the voluntary and community sector, I think we really welcome this proposal and a lot of the detail underpinning it. So, for instance, you know, the council is currently looking at its community and volunteering strategy, and I think it's very positive that the council's spending its time thinking about this. I think we're all aware that public services, you know, anyway were under a lot of pressure, but the last year and a half has made it even more so. And for the council to have spent this time, you know, setting aside staff time to think about it is very positive, and we hope that it's going to have a long-term improvement. Not that it was bad, but actually things can always be better, so that we'll see it as a very positive move forward. And I think certainly would support the proposals that are in your recommendations and your ask. I guess there are a couple of points I'd like to raise, and these are probably not new, but actually just a slight unease about emphasis on communities of geography. There are plenty of communities of interest that suffer vast disadvantage just because they're spread across some of our black and minority ethnic communities, some of our disability communities, especially those with learning disabilities, you know, suffer really life-threatening disadvantage, you know, in terms of the statistics of those that suffer actual physical abuse, not just you know, sort of behavioural abuse. And you know, I'd like to know how that's going to be addressed in terms of being missed out in terms of addressing their needs. I think the other thing just to lob in is that obviously there is there's the support that's being given to neighbourhood plans as part of the planning system. So I'd quite like to make sure we could look at that, so that even in those priority communities, those that aren't carrying out a neighbourhood plan, that could be one of the options on the table, because obviously at the end of the day that will have some statutory force in terms of helping to determine planning development approvals going forward. I know Boscombe's developing one. I don't think it's yet been signed off, but yeah, some of the other communities could be encouraged and supported to do that alongside the sort of perhaps bigger community plan. And there was one question. I wasn't sure what the asterisk was against West Howe on your slide about that, so I couldn't see if that was relevant, or whether that was because, as you said in your presentation, it's because those three neighbourhoods you have existing staff on the ground, and therefore that's why you've prioritised working with those three. And the only other thing I thought of in terms of learning was actually from rural areas. Some of you know that I came to Bournemouth CVS from Dorset Community Action, and while I was there, one of my roles was to manage parish planning And that's when there was money around from the then Countryside Commission to encourage rural communities to develop these action plans. And there was an awful lot of learning from parish planning systems that in fact could be translated into perhaps a more urban environment in terms of engagement and open agendas and moving forward. But generally really welcome this initiative, and we're very, very supportive of it.
That's very helpful, Steve. Thank you, and thank you also for the support that I know has sat behind getting to where we've got to so far, notwithstanding there's a lot of work still to do. If I might just collect some comments and then ask Kat to respond to some general points at the end. I don't think we need to do everything in as a direct response because this is the beginning of a conversation, isn't it? So, you know, those things can be picked up and taken away. So Tim and then Louise.
Yeah, I'd just like to really sort of support this approach. I've looked quite a bit as well at the ABCD approach. I think it's just a really good foundation, I think, to build on the strengths of the community, as opposed to going in and deciding what you should do with it. So I think that whole bottom-up thing is really worth supporting. I think Wigan as well is a good area. They've got loads of stuff online in terms of what they've done there with that kind of working with the communities and, you know, and building on their strengths, and they seem to have some great results as a result of that. Of course, a lot of this stuff already goes on, but I think just the sort of schematic you've got there, really, of trying to pull some of that together and link it, I think is something that perhaps is missing. You know, that there is so much good intention in the various communities. If we can sort of add to that and bring some sort of structured approach, so we know where we can add most value, I just think it's good. I think the whole approach is the right direction to travel.
Thanks, Tim, for the support. Louise.
Thank you. Thanks, Kat. I think, yeah, just agreeing, really. I think it's a great plan, a really good way forward. And I think that we've seen sort of over the last year how communities have pulled together to support each other during COVID. So it just seems like really good timing to kind of build on that and not lose that momentum, really. And I'd agree with Steve about communities of interest. I think that's really important, that's not missed from this. So if there's any way that we can help, we'd be keen to. And yeah, anything we can do to kind of help with the community engagement and sharing information, perhaps some of our volunteers might also be keen. So yeah, perhaps if I talk to you outside of this. Thank you.
Thank you, Louise. Always offers always very cheerfully received. Paul and then Councillor Rampton.
Thank you, Chair. I was also curious why an asterisk against West Howe, but also I think looking at the lanes. Sorry, I should say, firstly, I'm massively supportive of this, and Kat knows that from previous conversations and from my trustee role at West Howe Community Enterprises. This is something we've been trying to work on in that environment over a number of years. It doesn't come quickly. The thing I wanted to sort of raise was the extent to which we might need to give thought to the work that happens in, particularly, I think it was Lane 3, almost in terms of how we work as partners to communities, so we are able to better respond and receptive to their vibrancy.
Thank you, Paul. Karen.
Yes, thank you, Chair, and I absolutely support this, but I've got a couple of comments to make. And one is, I think people are a little bit kind of consulted out at the moment, so I'd really like to see innovative ways of reaching out and engaging with communities, and kind of less reliance on social media. That's really important, but not everybody is on social media. So anything that can be done that's slightly different, and I don't pretend I have the answer to that. And the other thing I wanted to say was I kind of agree with Steve about the geographical boundaries, and although it's really obviously very important to go to those more deprived communities, ABCD has to be a conurbation-wide approach. And in terms of adult social care, that is the model going forward, isn't it? Is that strengths-based approach. So I think it's really important that we don't just focus on that. We have to embed the concept of ABCD in our whole conurbation and not just in a few communities. Thank you.
Thank you, Karen. That's very valid. Apologies if anybody is having trouble with the service hub in terms of visibility. So we are doing our best to fix it, and hopefully the stream won't be. Yeah, Richard's under the table. So hopefully we'll get that fixed quite quickly. Debbie, do come in, but then Mark, I wonder whether you might have something to contribute in terms of the proactive work that the fire service does. Debbie.
Just a quick query.
I think that's one for Kate Ryan. Did I see you say you?
Hi, thank you. Just to clarify, it would be a new, in effect, subgroup reporting into the Health and Wellbeing Board. So we would be looking for partner commitments to really shape that agenda. Mike, I guess my reflection is that this really, I think, places that whole community agenda at the heart of the health and wellbeing framework. And when you go back to the strategy, it was our top priority to empower communities and tackle inequalities, although we perhaps are moving away from that language. So yeah, I'm very supportive. We do need to set up light touch governance, and that's where we would be looking for you as partners to contribute as we shape that going forward.
Thank you, Kate, and I accept the comments about the proactive decisions about the language that we choose, and this is very much an asset and strengths-based approach, but we must also continue to be honest with ourselves about the inequalities which some of our communities face, and we mustn't lose sight of that. We mustn't euphemism ourselves out of what we're trying to do, to coin Karen's phrase.
It's just for clarification, is who's looking at, who's overseeing this activity already? The activity is not new, it may be Poole that might be starting on patching, but I just wanted that, so I appreciate it's so new.
Yeah, I don't, Kat might correct me if I'm wrong, I don't think we have a senior strategic stakeholder meeting that is overseeing the work, and clearly the council works with partners. I think part of the issue is that there's a number of different partnering approaches moving into and wanting to engage with communities, covering different agendas, and I think this would aim to provide the forum and the approach that we could all get behind, whether that is actually looking at different issues beyond health and inequalities. Hopefully then as partners we'd all understand that that there are those networks into our communities where we know we need to focus.
Thank you, Kate. Mark, would you mind just sort of giving us a perspective from the fire service and all that marvellous prevention work that you do?
Yeah, absolutely, Chair. Thank you. Yeah, I mean, I would just echo colleagues throughout the meeting. Really, I think this is an incredibly positive opportunity for us all to work really collaboratively and put the communities at the heart of everything that we do. They really should be shaping their environment around them and the services that we're providing. So we'd be delighted to be part of this and help drive it forward. For us, it's really about trying to develop those healthier and safer lives. So it's not just about health. It's actually about that safer environment, which obviously will lead on to then potential accidents within the home and within the community. And we see that as a lifelong opportunity of learning and engagement, regardless what the subject is. I think we can positively contribute to all of those. So thank you, Chair. Yes, I'd welcome the opportunity.
Brilliant, thank you. Kat, would you like to respond to the discussion? I think probably not to every detail, because you can see, I think, the interest and the commitment that there is from the board, but do you please address West Howe and the asterisk?
Thank you very much. Thank you, everybody, for your really positive comments. It's great to hear. Just very quickly, no, we are not doing this to the exclusion of all of other communities of interest. This presentation was obviously tailored to the board and the work that needed to take place around health equalities. So all of that around our other communities of interest still goes on, and will still continue to go on, and hopefully the structure that we're proposing around that board enables clearer routes for that work to be escalated. In terms of West Howe, the asterisk there is in recognition of the fact that we have an incredibly strong charity already operating in West Howe. So West Howe Community Enterprises, extremely well established. This is one of our, almost like our great success stories. So we had a community development working in West Howe for over 10 years, and through that, using those strength-based approaches, West Howe Community Enterprises developed, came forward, took over a shop, started operating that, running that, grew as a charity, then moved into Henry Brown, then attracted, and I'll look at Poole here, 400,000 funding, 400,000 funding in order to deliver community development and asset-based approaches themselves. And this is what it's all about. It's about us working with and enabling communities to do for themselves, and they are doing for themselves. So for us to jump in and suddenly take over the reins again would go completely in the face of everything that we're proposing. So for West Howe, it's about us having those conversations about what support do you need, what can we help you with, not us trying to dive in and then take over everything. So I hope that clarifies the asterisk there. And
thank you.
I think that's everything really, if that's all right, Councillor Green.
Brilliant. Kat, thank you very much. We don't have a formal recommendation as the board in the way that we sometimes do, but I think it's very much an invitation to start the conversation, to make sure that we're all talking to one another, and perhaps we could give some thought as to whether it would be appropriate to bring the Health and Wellbeing Board in somewhere in that timeline at the appropriate, applying the commitment of the partnership in the way that you need it. Brilliant. Thank you very much. Now, in terms of, follows very, very nicely, actually, that we now start talking about one of those communities of interest, albeit that everyone is an individual. And Terry Reynolds is going to lead us through the improvement journey that's currently going on for children and young people with special educational needs and disabilities. Terry, you're very welcome to the board. Perhaps you'd like to introduce yourself for those who haven't met you.
Thank you, Chair. Yes, I'm Terry Reynolds and I'm an education consultant working for BCP. I was asked to come and work for BCP because my previous experience has been as a director of education, both full-time and then subsequently an interim post in a number of authorities. And while the new leadership of Children's Services was establishing the new director of education post, I was asked to come in and give support. Subsequently, with the illness of Simon Mackenzie, who's service manager for SEND, I've been moved across with Kelly Twitchin to do some work around SEND. So that's my background and that's what I'm doing here today. And so this report is an update on progress with SEND improvement, and members of the board will know that there was a local government association peer review of SEND services in January 2020 that identified a number of issues that needed improvement. And subsequently, partners established the SEND Improvement Board, and that SEND Improvement Board then received a report in October of 2020 from Anthony Douglas, who's the Independent Children's Advisor, on a diagnostic of statutory SEND services, again to look at the most critical issues needing improvement. And so there is an improvement board and a learning and improvement plan arising out of those reports. And this report gives you an update on progress. It's worth noting, I think, that the issues facing BCP are common in almost all local authorities around the provision of effective SEND services. And indeed, there was an Ofsted report published only yesterday under the title of SEND old issues, new issues, next steps, which rehearse the fact that there are systemic issues widespread reflected in SEND area inspections. They highlighted 3 in particular that are common weaknesses: a lack of joint commissioning, that co-production doesn't work effectively, and poor quality of education, health and care plans. That's what they found across the board, and I think that's widely recognised. The other one that I would add is that there are 151 local authorities, and all of them have deficits in their high needs block, which go to fund SEND services. The conclusion of that Ofsted report is that reform to the SEND system is even more urgent following the pandemic than it was before. So there are 6 systemic issues that BCP shares in, but there are a number of kind of urgent concerns that we have. The aspiration of all of the people working in the service is to provide the best possible service for children and families so that children with SEND can live healthy and fulfilled and successful lives. There are a number of challenges in providing the service that we wish to do, but I would highlight there are 2 particular things that BCP, we don't yet have the mix, the continuum of provision right from mainstream through to very specialist provision, and the budget pressures are not only substantial, but they are increasing with increased demand on the system. And that's a challenge to provide an effective system and manage the budget as effectively as possible as well. So people will have a chance to see the presentation in the pack and read the report, and I'll answer any questions if I'm able. Thank you.
Terry, thank you very much for that. Any questions, comments from board members? Tim.
I mean, thanks for that. It's clearly a very challenging area, isn't it? And it's very emotive for anyone that's been involved in it as well. And we've certainly seen, on the health side, a lot of interest in this area and a lot of representation from the families involved. I mean, it is an area I think we need to do better on. I think that probably needs to be said. And it's good to see some of the improvements that are sort of coming through on this journey. But I think when you look at this and the following paper, just in terms of some of the assessments, I just think we need to acknowledge we have got a long way to go on this to sort of do that. But I know the report and some of the improvements that have been said there, and the fact that we can actually list out the areas that need the improvement as well. I mean, that's kind of the start, isn't it? So I welcome the report and try and support as much as we can on it. But it's a very challenging area we've seen here.
Indeed.
Thank you, Tim, for that recognition. Any other comments? Kelly, again, if I could just turn to you from that very, specific perspective of corporate parenting. A lot of our young people in care do experience additional needs, and I know that you are pushing forward that improvement journey as well. And thank you to Terry for noting the other work, but I think it would be helpful for board members to hear that.
Yes, so for children in care and also for care leavers, and as of September, my role will also extend to all young people with a social worker. So having an additional layer, having that extra support and that extra oversight for our children in care to ensure that those with SEND are getting everything that they receive is certainly a bonus. We've looked at ensuring that the SEND team are as upskilled as they can be. We've seconded a member of my team over to their team in order to prioritise and upskill staff around children in care and their needs that are also additional to those that are on their plan. And we've also appointed a lead in inclusion within the virtual school to again have an extra layer of oversight around ensuring the timeliness of completion for EHCPs, annual reviews, and to ensure that there's early identification of need as well. So we certainly recognise it, and we are working very closely with our SEND colleagues, which at the moment has been very easy for me, having 2 hats on at the moment, so that's been a real advantage. But yeah, we are continuing to support, we are continuing with those relationships, and we continue to monitor the support the young people in care.
Lovely, thank you, Kelly. Louise.
Thank you. I just wanted to raise that we've one of our projects this year is we have a group of young listeners, so a group of 11 young people who are designing an engagement project themselves, and as part of that they'll be going out and speaking to young people who are in the SEND category, and so yeah, I'll feed all those insights into the board when we get them, probably in a couple of months' time. Just to let you know about that.
That's very encouraging, Louise. Thank you for that. Kate.
Thank you, Chair. I just wanted to flag, I guess, from my area of council service delivery, looking at preparation for adulthood and the need for suitable independent housing options. So I know we have done some work, particularly at the moment, focused around care leavers, but again, we've got various commissioning strategies being developed and the housing strategy, and we do have in-house housing development abilities as well. So I think it's just something to flag that we also across the council services can beyond those you might traditionally think of can be involved in helping with this journey too.
That's really helpful, Kate. Thank you. And I think it reminds us as to why we need to have the conversation within this board, because it's education, it is health, and it's care in all its meanings that are part of those plans. Jan.
Just from that theme around preparation for adulthood, we're doing a lot of work in looking at what how it can really promote independence and choice and enable young people and young adults to achieve what they want to. I just wanted to highlight one of the key areas is about training, but also employment. And I just wanted to sort of say to us all, many of us around the table have very large organisations, and I think we probably could do more to think about what are the employment opportunities in those organisations that we can really create and really support people into employment who are either young people coming through the SEND services and also adults with disabilities. So I just wanted to note that I think there's probably more we can do in our employer roles in that area.
Thank you, Jan. That's a really timely reminder, and it would be great if everybody could focus their minds onto, any experience that they might be able to offer. I think we've probably covered off most of what we need to as the board. Terry, thank you very much for all the work that you're doing. I know you and I are in many of the meetings together, and this is just one of you today, and for talking to board members.
Thank you.
I'm sure we'll see you again.
Yeah.
Thank you. Right, we are now on agenda item 13. In the right place? Right. Discharge programme, and I think this may have been circulated on a separate cover, and Jan is going to talk us through it. Thank you.
Thank you, Chair. So this report is asking for delegation to the Chair and Vice Chair of this board, in consultation with the Cabinet Member for Social Care and Health for the Council, to take any decisions that may need to be taken around funding which is coming to the integrated care system to support our hospital discharge. The report sets out that since the pandemic began, that all partners across the NHS, councils and indeed voluntary sector have been engaged in radically changing the way in which we manage and think about people, particularly leaving hospital, but actually ensuring that only those people who need to go into hospital is an important element of this. And we have radically changed, initially at great pace last March, in March 2020, the way in which hospital discharge takes place, so that actually people do not stay in hospital and have a full assessment of their needs and go on the recovery journey within a hospital setting, but actually at the earliest possible opportunity, when they are medically fit to leave hospital, we are trying collectively to enable them to go hopefully home first, but to the right place to have continued care, treatment and particularly recovery, and then term needs. Now, the government has provided, as you can see, funding through that period to enable this, and they have had various different schemes. So a scheme from mid-March to September 2020, a different scheme from September to effectively the end of June, and then a slightly different time frame to the end of September. And in terms of the most recent element, so from April, the funding is now coming to integrated care systems in a capped way. So previously, Health and Social Care was able to submit our returns based on this is what we spent on individuals, and that there's then received from a national pot. Now there is a capped sum. And so there is an issue around particularly how that capped sum is divided between different health and wellbeing board areas, and the guidance, as you can see, is very clear about giving health and wellbeing boards and those areas an equal interest in how money in the capped sum is divided. There are also likely to be issues around the adequacy of that capped sum to meet actually all the costs. And then we have a further issue about how do we as a system fund sustainably this kind of model is the right way forward, both for people in our communities, our resources to maximum effect across the NHS and care and the voluntary sector. So I would want to say at this point that some of the Scheme 3 guidance, we are expecting hopefully some further clarification on the guidance, particularly through the national adult social care routes. But given the board doesn't meet until October, we're asking that the chair and vice chair, in consultation with Councillor Rampton, are given authority to make any required dedicated decisions. That's obviously within the framework the councils and particularly the CCG have for making decisions, because that will be in conjunction with similar delegations which are being considered at the Health and Wellbeing Board for Dorset on the 23rd of June.
Thank you, Jan. Any questions or comments? Sam.
Thanks, Chair. I just have one question. Is that capped sum that's referred to the cap that applies to the ICS or the BCP share?
The figure, the 8.4 million is...
Thank you.
Yeah. Tim.
Yeah, and I'd just like to support the paper. I think it's a pragmatic way of managing this. I think what we've seen certainly over the sort of last 12 months plus, there's been a lot of stuff sort of quickly, and we need to sort of adapt and do that, and decisions, and care homes coming on and coming off and everything. So I think it does present a pragmatic way to actually deal with this going forward. And we've done similar within the CCG as well. That we've had to delegate down to chief exec and chair to be able to sort of keep pace with some of these decisions. I think, as we've mentioned, the cap there, that is going to be a challenge, because we've been spending at a rate which is greater than that. So that does put a quite significant challenge in the system across Dorset to actually live within that means. And I think we have seen the benefits over the last year actually of kind of having the uncapped amount, because we've moved people through the system very quickly at times to be able to do it, but that's not a sustainable model really. The financial realities are being put back around the system, and certainly around the NHS, and I'm sure the local authorities as well. But I'd support this as a way forward.
Thank you, Tim. As you say, it's a point in the journey, isn't it? It's that we won't necessarily all be together in order to be able to make that decision, and nobody takes delegations outside of meetings lightly. But to give board members assurance that the council has its own appropriate schemes of delegation that this has to fit within. I'm sure, Tim, you have your own governance, and this needs sensible people working hard to deal with a difficult set of circumstances, and it's only when that reaches a sensible conclusion that Tim and I would use that delegation that is being requested. It is quite a big thing to ask for, and we wouldn't normally go to a vote when we can do things by consensus, but I would just appreciate knowing that there is the full support of the board to take this decision forward. Well, there's not. Thank you very much.
Chairman, just to clarify the record, I think that was an agreement from every member within the room.
That's very helpful, Karen. Thank you.
Chair, you're muted.
You're on mute, Chair.
Thank you. That was a beginner's mistake. For any members of the public who are watching, you won't be able to see a dialogue that's been happening in a sidebar of members present, and I'd just like to make it clear that we asked for help in an earlier paper about opportunities for young people with special educational needs and care leavers, and that lest you think that those conversations go nowhere, there have already been 3 or 4 offers of support from people who've been attending the meeting. So I won't hold anybody up, but thank you to everybody who's got involved, and I hope that we're really able to bring something forward out of it. So we will now return to the agenda, and we are item 14, back on the main agenda. And Jan, it's you again, please, I think.
Thank you, Chair. So this is a report which is about how we're developing our top-level partnerships, really. So it has 3 component parts. So the first part is the recognition that the health and context where it needs to work in a considered framework with other top-level partnerships. So Community Safety Partnership Board, the Children's Partnership Board, and the Safeguarding Partnerships and for children and for adults. And there are occasions where we need to be really clear about which top-level partnership is dealing with an issue and how does that link with the agenda of other partnerships. So just to give one illustration, we have in the Community Safety Partnership recently in the last week's been having conversation around actually how is reducing the harm of substance misuse seen within the statutory context of the Community Safety Partnership, because it actually is key. It is a key statutory responsibility of the Community Safety Partnership. But in fact, in terms of the harm and the misuse of drugs and alcohol in our community, that will have a profound impact also on the agenda of the Health and Wellbeing Board, on the children's agendas, and on the 2 safeguarding partnerships. So if you take that as an illustration, it's about how do we do the work in the right, how do we feed that into our partnership structure in an effective way. Now, there's an immediate suggestion about how we do some pragmatic things to strengthen the interrelationship between the top partnerships, and that is to extend an invitation to the chairs, independent chairs, and the chairs of the 4 partnerships, so BCP Community Safety Partnership, the Children and Young People's Partnership for BCP, the Dorset Safeguarding Partnership for Children and the BCP Safeguarding Adults Board, to invite all those chairs to be to have the right to observe and participate in any of our board meetings, which will mean they'll also receive routinely the papers, and for them also to be able to request that items are put on the forward plan. So as an example, we have a new chair of our Safeguarding Adults Board for BCP Council, same chair for Dorset Council Areas Board, and I know that Sian Walker would very much want to take up her statutory requirement to report to this board during this year. So that's one example. So that's a pragmatic solution. Further, the report is recommending that there's work done, and it probably will need to be on an ICS basis as well as a BCP basis, which sets out the framework of how the top level partnerships are working together. And what you can see in the paper, there's been a tremendous amount of really good work done about forming all those partnerships in the landscape post local government reorganisation. But actually now we need to create the framework document that says how do those partnerships work together. However, in that mix, of course, we have the arrival and the development of the Dorset Integrated Care System from some point in April 2022 or at some point in the beginning of 2022. Others may want to comment more. And so that means that across our partners and partnerships, we're needing to think around how do we want to work in a new context of the integrated care system. And so this report proposes that the Health and Wellbeing Board itself has a development where it looks at the development nationally and locally of integrated care systems, and how the BCP Health and Wellbeing Board itself feels that it can work most effectively in that Dorset ICS new arrangements and can contribute to their development. So 3 recommendations. One, that independent chairs become formal observers of the board. 2, that there's a development session to look at the development of the ICS and how this Health and Wellbeing Board wants to work in that context. And thirdly, that by December, there is then a partnership framework document for this board and indeed the other partnerships, which set out how those partnerships are working effectively together.
Thank you very much, Jan. Any questions or comments from members? Sorry, just looking at anybody else. I think it's a very well set out, sensible solution. I think everybody would welcome that additional support, as well as the more direct interface that exists could exist through those parts of the governance, and it would strengthen us as a partnership. Also, I think the delivery need to do as a board around the ICS would be very welcome. I think it's the right time to do it, and we need to find out where those planned Dorset arrangements work very well, and where we need to be absolutely clear that we're reflecting the interests of our own communities. Sam.
Thanks very much, Chair. So it's a really helpful paper, and I completely endorse the work that we now need to do to look at how those top level partnerships operate. And I was just going to flag for Health and Wellbeing Board members' attention, if they haven't seen it already, the design principles for the ICS were actually published yesterday. They came out quite late. I've got a copy on email. I'm more than happy to provide them via Karen to board members. And it does talk about the importance of that sort of place-based partnership forum in bringing forward an integrated plan that looks at the improvement of outcomes around health and care services. So we're going to need to spend time thinking about the implications of that, and to build on and not lose the really, really good work that the Health and Wellbeing has done to date, and make sure that we've got a working model to take that forward.
Brilliant. Thank you, Sam, for that support, because you and other people around the room are clearly very involved in the Dorset work, which is going on, others of us less so. So that's a very welcome way to go forward. Karen, are we able just to acknowledge that and to reference our terms of reference, which we agreed at the beginning of the meeting, as Jan suggested. Thank you. Which takes us on to the last item before we get to my last items, which is our forward plan. Has everybody seen it and looked at it? We've made reference to some of the work that we will need to do on the forward plan over the course of this meeting. Don't think anything's come up which we need to add to it at this point. So if we're happy just to note it, but also for any members clearly who have items that they wish to raise for our future work, you know, that invitation is always there. So that does, I think, Tompkins, bring us to the end of the formal agenda. There are two additional points that I would like to make. Apologies, I'm going on to the Teams meeting, and they are individual items. James Vaughan, we're very pleased to have you here. Will this be your last health meeting, or will we see you again later in the year?
Thank you, Councillor Green. I'm in post until the 13th of October, so my memory doesn't allow me to remember when your next meeting is.
Sorry to interrupt, Mr. Vaughan, but I think our next meeting might actually be the day after, but don't quote me on that.
In which case, Chair, then this is my last BCP health and audit. I will be still involved in the integrated care system in the few months I have left. Thank you. You're on mute.
Nearly. Well, I'm very pleased that we won't be leaving you losing you completely, but I'm sure the board would wish to thank you for all the support that you've given in your years of service and to the locality of BCP through the whole time of LGR. Of course, you were in position prior to that. So, James, thank you very much for all the support you've had, and we wish you very well in your years ahead.
Thank you, Chair. It's very kind. Thank you.
Thank you. And another very sad farewell that we have to say is to Jan Thurgood, who has, if I may say, very big boots, and we are also very grateful to you, Jan. You have been an extraordinarily supportive member of this board and its predecessor board. Never mind all the other jobs you've done through the day job, through your years with Poole Council and latterly with BCP. You leave with our very warm thanks, and we will manage without you. But you have shaped this board, and we have on so many occasions been grateful for your patience, your tolerance, and your very calm steers, which have enabled us to make sure that there have been very few pitfalls, and your guidance has always been so very much appreciated. And I can see very many nods around the room, and if you would perhaps just like to say farewell, we will miss you very much.
Thank you very much, Chair, and thank you for your very kind words. And I suppose my comment would be today, I think today has been a really great meeting and really good to see the agenda going forward. And as a BCP resident, I shall really look forward to seeing how things develop.
Well, I look forward to the next public item then that will be coming forward. Thank you, Jan. Thank you all for a really engaging meeting. I know we're very spread out around the room, but thank you for working with us amongst the arrangements that we've had to use. Thank you to everybody who's attended, board members who've attended virtually, and to any members of the public watching. Thank you very much, and I will close the meeting now.